Our next speaker is Dr. Hema V, who will be detailing on how to maximize your fellowship outcomes. She is currently a retina fellow at Comtrust Eye Hospital, Calicut.
Good morning, everyone. My topic of today's presentation is how to maximize your fellowship. I myself feel that I'm too naive for this topic, but let me discuss some of my plans and what I have seen when I did my DNB, the other fellows are doing. So, super fellow is a myth who has a clinical skill, surgical skill, academic and research excellence, and some knowledge in administration. But can we reach the? Yes, as we do for all cases, we have to observe, listen, and reflect. So before joining a fellowship, you should know the fellowship program. Many of the Prime Institute have a well-structured program. They consist of mainly a general period, usually 3 to 6 months, and a peripheral posting and a department posting. If you are not joining a Prime Institute and you don't know about the structured fellowship, what you can do is you can join the institute where you are planning for a fellowship for a short-term observership, or you can either join the Prime Institute itself, and you can understand the fellowship process there and then decide on joining the fellowship. So the general period, what you'll be doing is you'll be managing general OPD, you'll be seeing emergency cases. In that period, you can build up a rapport with the other doctors, know about other specialties, and for anterior segment fellows, they'll be giving cataract cases, SACS, etc. And also, you have a chance for a comprehensive management of the patient. So what you can do in the general period is that you can note all cases, which most of the institute, you will be referring the cases to the specialties departments. So you can note the cases where you have sent the patients, and at the end of the day, you can see the medical records and find out what findings you have missed, the diagnosis, and even follow up the cases. At the end of the day, during the break period, you can chit-chat with the fellows or consultants from the other department and discuss about the case. Like that, during the general period, you can build yourself as a more better comprehensive surgeon. Coming to the peripheral posting, every posting is an opportunity. Peripheral posting also is not bad. Some people feel it a waste of time. But actually, in Prime Institute, you will get a better surgical exposure in peripheral posting. That is, you will be able to do cataract, DCR, excision, some gives trap, and enucleation calls for sure. The extra benefit of a peripheral posting is that in most of the centers, you will be the single doctor. So you'll have to administrate the hospital, like you will have to see the accounts, staff posting, purchase also. This will also increase your experience in the administrative department. Coming to the department posting proper, the most important posting is the clinical posting. So 3 steps for a better clinical experience is that shed your ego. One cannot learn what they think they already know. Observe keenly and ask. Whom or what to observe? Definitely your mentor or your senior. Observe how they take the history, their clinical findings. If you have missed something, discuss with them. Document your findings and also the senior findings, what you have missed. And if you are doing a retina or a cornea fellowship, better draw your clinical findings, show to your seniors. And also observe how the consultant interact with the patients, how they discuss about the disease to the patient, the prognosis, the surgical prognosis, etc. That also give you a learning experience. So how to improve your clinical skills? Always be ready with your gadgets anywhere, be it the gonioscope or indirect. The more you practice, the more better clinician you will be. What you can do is you can either write a note on what patients you have seen at the end of the day, what you have observed, what you should read about the case, etc. Or better, for an easy access, you can make a WhatsApp group or note in the phone, and you can document what you have seen. So the most difficult part in any busy fellowship is reading. As we all say, at least we should read 1 hour both medical and surgical, which even I found it very difficult. So a busy fellow, what to do? There is no bypass to books. What your mind knows, you will see on the patients. So there is no substitute for a theoretical knowledge. I at least try to read for the classes and also some publications related to the topic. Watch the videos in the YouTube, especially both theoretical and surgical. And when you are free while you are driving or something doing, you can also listen to the videos. And coming to the surgery, if you have a previous surgical experience, it is good, especially during the post-graduation. But if you don't have, what to do? I will suggest one thing is that you can do a short-term fellowship like FACO or SACS, so that you will get some improvement in your hands, better suture skills, etc. Like that, most of the institute you will be having a short-term waiting period, like 3 or 6 months. At that time period, you can have a 2 months short-term fellowship in some other institute, so that your surgical skills will be improved. This applies for persons who have very little exposure during their post-graduation. Preoperatively, scanning through the case sheet is very important. The patient's OCT, HFA, corneal topography, IOL power calculation, even for posterior segments, see how the IOL is calculated, whether it is correct, etc. And previous surgical notes, if it is re-surgeries. My all notes comes in relevance for retina department. Sorry for that. For cornea also see what all sutures are done, etc. And also go through the anesthetic workup, whether the fitness have been, the patient has taken the fitness, etc. And previously examine the patient as a general, whether the patient is fit for the surgery, so that nothing is missed and the case is not postponed. Ocular examination is very important, and documentation. Prepare yourself on the day of the surgery. Even previous day you can plan the surgery, discuss with your mentor or your seniors what this case, how to go about, etc. Read about the surgeries, and especially the machine which you are using, if you are using it for the first time, and even if you are doing some new procedures. Watch the recorded previous surgery of your mentor, preferably, or from YouTube, and wet lamp procedure, especially for anterior segment surgeons. At OR, make sure you are mentally and physically comfortable, well fed, and build a rapport with the theatre staff. During assisting, the initial learning process is assist and ask. The surgical procedure is always not a hurry. Be slow and steady, and feel free to ask. And when you are making a complication, make sure that the complication should be, your senior should be able to manage the complication. Postoperative day, careful examination of the patient, and initially it will be difficult to diagnose the complication, and try to, if you see more and more cases, try to find out what you are missing, and complication management by your senior and follow-up of the patient is important. Surgical logbook is a must. Discuss the case, what you have done normal, also what mistake you have done with the mentor. You can show to your mentor, and this is my mentor who has made corrections in my surgical notes. So as has told, number matters, but also repeatability. You should be able to do the step in the next case also. So in writing the surgical notebooks and discussing it helps you in that. Research and publication is a must for all fellows, and set a goal like I'll make this much publications this year, etc. Try to be a part of clinical trial if possible in your hospital. Start with small case report, even if it is not in an index journal. Presentation, make it a routine, so that when going to a conference, you'll know what is happening beyond your hospital in your specialty. Chat with your colleagues, meet and hear the stalwarts in your field through the conferences. And all conferences are not your cup of tea. If you go to 1 or 2 conference, 1 or 2 years, you will understand which one to go and not to go. Administration is also should not be neglected. Even if you are not planning to set up your own practice, you should communicate with the hospital staff, counseling, insurance, finance also. You should know about the quality checkup, etc. and how the finance is maintained, etc. So that even if you are not practicing, this will add to your experience. And last but not the least, teach your juniors. Work-life balance, I think Anju will be dealing with this better than me. So fellowship is a period of commitment and sacrifice. Observe everything, absorb good, be prepared, be kind, and share your knowledge. Enjoy the process. Thank you.
Thank you, Dr. Hema, for that inspiring talk on how to maximize your fellowship. Many times we just think that you just join a fellowship and that's over. But no, every person who joins a fellowship, their experience is different. It gives you, the fellowship gives you what you take from it. So you think about how you can make the maximum use of your fellowship. Next,